Let's turn now to the impact of COVID's resurgence in many states and take a look at how it's hitting California hard, despite the state's earlier success. California broke new records with the virus this week, leading officials to order new restrictions in more than 90% of the state, at least until December 28th. Stephanie Sy reports that in Los Angeles County, frontline workers and communities of color are bearing the brunt of the pandemic's toll.
At the Olive View UCLA Medical Center, COVID-19 patients are often first seen in the emergency department, where Dr. Greg Moran works.
Most of those people, we do a swab on them, we check them out, make sure that they're stable, checks their oxygen level, and we send them home.
But too many have ended up in the ICU, where Dr. Nader Kamanger sees patients.
In my 20 years of being an intensivist, an ICU pulmonary specialist, this is the worst I've ever experienced.
This man had pneumonia brought on by coronavirus. He was placed belly down, a technique doctors have learned can help oxygenate blood in COVID patients and save lives.
It's room after room of critically ill patients with COVID. By the time they make it to the ICU, they oftentimes require being placed on a mechanical ventilator.
A critical shortage of experts who can operate ventilators and deliver high-flow oxygen is a bigger problem than physical capacity.
In certain types of disasters, like if there's an earthquake here, we can bring in people from outside who can help out and provide some of that care. This is a disaster that's happening simultaneously all across the world.
Compared to a month ago, LA County now has 5 times the rate of hospitalizations and nearly 4 times the number of daily deaths. At a daily briefing earlier this week, grief overcame the health director, Barbara Ferrer.
Over 8,000 people. Over 8,000 people who were beloved members of their families are not coming back.
New restrictions began this week in most of California. All restaurant dining, even outdoors, is banned. So is non-essential travel. Beach going is okay, and now also playgrounds, but only after an outcry from parents. Some question the lockdown.
His school shut down, and he started putting on a lot of weight, and he started just getting bored. So I was just like, okay, we have things to do during this time, but what about the kids?
Right.
So it's very confusing.
Where there was an existing gap between how COVID affected people of color and white people, the latest surge shows a chasm. Dr. Deborah Prothroth-Stith is dean at the Charles R. Drew University of Medicine and Science in South Los Angeles.
The Latinx community in particular here in Los Angeles is really experiencing this third surge, if you will. But the deaths are just tragic. And both in Black and brown communities, you have higher death rates.
LA County reports that it's seeing new COVID cases among Latino residents at more than double the rate of white residents.
I lost my job. I lost my housing.
The pandemic has torn apart 30-year-old Jacqueline Gonzalez's life.
Due to the point of the COVID, I had reduced hours, little by little, reduced days. Schools were closed. The kids were unable to go. I didn't have nobody to leave my kids.
She says she was forced to leave her job at McDonald's, and now she's homeless and living in a shelter, which makes her and her 4 children even more vulnerable to contracting the virus.
There's a pandemic within the pandemic.
Barbara Kapos is the executive director of the East Los Angeles Women's Center.
For many of our families we're working with, they don't have the rent to pay. Adding that to whatever hardships they had before, and now because of COVID-19, this is multiplied.
All these problems will continue to get worse unless more people follow prevention guidelines, say officials, which is why outreach workers armed with informational flyers are fanning out to hotspots, from shopping centers to streets.
We hope to educate people and get them to practice better behavior.
Some outreach workers have not had an easy go of it. Jasmine Flores said one of her colleagues was spat on.
He just turned around and spit on his face, like coughed really, really hard, and he just left.
Is there a trust issue between some of these communities of color and government?
There are trust issues for generations. And I think surveys of Latinx and African American communities make it very clear that people are very skeptical of the vaccine.
Long-standing inequities in health and education and the undertow of pandemic fatigue have culminated in a perfect storm raging in hospitals.
I don't want to be an alarmist, but we are struggling. And I see this on a day-to-day basis on the faces of our nurses, our staff, our young doctors, our residents who really are grappling with this. Not only the burden of the number of patients we have to take care of, but just the sheer amount of time that we've been under this stress.
Surgeries have been canceled, and if things get much worse, the next step would be rationing care to those deemed most likely to survive. A crisis mode that not so long ago was unthinkable in the Golden State. For the PBS NewsHour, I'm Stephanie Sy.